And still talking health matters, the federal government has announced plans to establish medical rehabilitation centers across the country with a strong focus on neurorehabilitation for persons living with the spinal cord injuries. Senior Special Assistant to the President on Special Needs and Equal Opportunities said this at a gathering to mark World Spinal Cord Injury Day. And TVC News' Kemi Balogun has more on this.
Globally, spinal cord injury remains a major cause of disability, with devastating effects on physical, mental, and social well-being. In Nigeria, thousands of new spinal cord injury cases are recorded every year. Olushola Ojo and many others here form part of these statistics. He is living with a permanent disability caused by spinal cord injury.
To survive spinal cord injury is no joke. After survival, to manage it is extremely expensive, and most often times we are dependent.
Most fall-related spinal injuries in Nigeria are linked to unsafe environments and risky behaviors. Rehabilitation remains key to improving the lives of survivors, but access is still a major challenge. At this gathering to mark the World Spinal Cord Injury Day, the Senior Special Assistant to the President on Special Needs and Equal Opportunities, who is also a spinal cord survivor for the past 17 years, says one key goal of this present administration is to establish medical rehabilitation centers across the country with a strong focus on neurorehabilitation.
This initiative is currently at the situation assessment stage, carefully evaluating existing structure, identifying gaps, and laying the groundwork for the development of a national policy on rehabilitation strategy plan. When fully implemented, this framework will transform the rehabilitation landscape in Nigeria and offer renewed hope to countless individuals and families.
In his activities, I know that say government policies, the association does that every day. And professional support must work together for real impact through urgent government action in order to curb preventable falls and protect millions from lifelong disabilities.
We see how have we fared in the support to people with spinal cord injury. And then we look ahead to see that how do we improve our strategies so that going forward we change our styles and we become better in the way that we help and we support and we champion the cause of people with spinal cord injury.
When we reduce risks, raise awareness, strengthen access to care, we create a safer and more inclusive Nigeria.
Experts insist many spinal injuries may be prevented or better managed if care is timely, compassionate, and widely accessible. Kemi Balogun, TVC News, Abuja.
And joining me now for more discussions on this is a consultant neurosurgeon, Wellington Neurosurgery Clinic, Dr. Cyril Okwata. Good to have you on the news at this time. So we understand that statistics on spinal cord injuries in Nigeria is a little bit scarce, or let's say it's a bit limited. But existing data now indicate that more men rather, are affected than women. What factors do you think are driving this trend? And of course, the challenges that the country faces now in tackling this growing health concern?
Thank you very much for having me. Yeah, spinal cord injury is the most devastating injury known to man. Cervical spinal cord injury is actually the most devastating injury known to man. Yes, the ratio of spinal cord injury in Nigeria and indeed across the world tends to be, male to female ratio tends to be 4:1. And the reason is not far-fetched, simply because men are more risk takers and they are more likely to be on the road, because spinal cord injury selectively affects young adults, people from the ages of 30 through 45 years of age. And when you look at the causes of spinal cord injury, the most important risk factor, cause is important, but the most important risk factor is road traffic accident, automobile crashes. So males are more likely to be involved in road traffic accidents than females, okay? The males are more on the road. Females are more or less on the road. Males are more risk takers in sporting activities. Males are more risk takers. They are involved in buildings, environments where the tendency to fall is high. So this is in a nutshell the risk factors that increase the risk of spinal cord injury. More male predominant.
The government also. Okay, go ahead.
Talking about the impact. Talking about the impact on the economy. Just as I said, the prevalence is more between the ages of 30 to 45 years old, and that is when these individuals are starting to become very impactful with respect to the labor force and the economy. And a young man or a young woman who previously was independent and the breadwinner and working so hard suddenly becomes immobilized by this injury and is now dependent and requires needs for activities of daily living. So that individual effectively is almost subtracted from the economic workforce of the nation.
Right, point taken there. So, let me quickly come in here, because we understand the government has also proposed establishing a medical rehabilitation center for spinal cord injuries. But from your own point of view now, what would you take to ensure that this centers truly become effective?
Well, the idea to establish rehabilitation centers across the nation is a laudable one. A noble one. To make them effective would require huge amounts of resources, to be honest, because the burden of injuries, spinal cord injury, to be precise, is enormous on the individuals and on their families and on the communities, as we just discussed previously. And so it's to rehabilitate just a single person who suffers spinal cord injury. It requires enormous funds and resources in terms of equipping the centers, with facilities to work with, in terms of the personnel. Okay, the personnel to rehabilitate such individuals will require a multidisciplinary approach, where you have a team of neurosurgeons, a team of critical care nurses, a team of physiotherapists, occupational therapists, speech therapists. And these individuals or these specialists are not very much available across the nation.
Right.
And so to organize them will require a lot of resources, to be able to galvanize their specialties and make impact in neurorehabilitation.
And we hope that we have enough resources to address this health challenge. Thanks a lot, Dr. Cyril Okpata, for your insights on the news at 10 tonight.
Thank you very much for having me.